Topic for discussion is necrosis and gangrene with competency number 2.8. In this competency, students should be able to identify and describe the various forms of the cell injuries, their manifestation and consequences in gross and microscopic specimens. So there are various forms of the cell death. For example, apoptosis, autolysis, autophagy, necrosis. So in this topic, we'll see one type of the cell death, that is necrosis, and its another subtype is gangrene. So what is meant by necrosis? It refers to the spectrum of morphologic changes that results in cell death in living tissues. This is due to the progressive action of degradative enzymes liberated by the cells, and it is irreversible. It is associated with inflammatory reactions. Both grossly and microscopically identifiable features are seen in necrosis. Another type apart from necrosis is autolysis. Lysis is breakdown or the destruction auto itself. So here the cell digestion. It is disintegration of cells by its own hydrolytic enzymes in non-living state. Own hydrolytic enzyme disintegrate the cell in non-living state, that is nothing but the autolysis. Necrosis in living tissue and autolysis in non-living tissue, and it is because of liberated lysosomes. Now, cell death is recognized by its morphological changes, ultrastructural changes, and biochemical changes. In morphological changes, grossly changes in appearance, structure, and color, and microscopical changes in which this is the normal cell, this is the nucleus of the cell, and this is the cytoplasm. So changes occurred during the necrosis are, first is pycnosis. Pycnosis is just condensation of the nucleus, clumping or the condensation of the nucleus. After that, karyorrhexis. Here rhexis is fragmentation or the breakdown of the nucleus, multiple fragments of the nucleus with this cytoplasm. In karyolysis, there is a complete destruction. It only shows granularity in the cytoplasm. Now next changes ultrastructural and certain biochemical changes. Now another form of necrosis with superadded putrefaction is nothing but the gangrene. So what is meant by gangrene? It is a form of necrosis of the tissue with superadded putrefaction is nothing but the gangrene. Here the putrefaction means superadded infection by anaerobic organisms like Clostridia, Streptococci, bacteroides, and predisposing factors for the gangrenes are the factors which causing the ischemia. For example, in case of atherosclerosis, diabetes mellitus, and TAO, that is thromboangiitis obliterans. First, we'll see necrosis and its types in detail, and after that, we'll see the gangrene and its type. So we start with types of necrosis. First is coagulative necrosis. Second, liquefactive necrosis, gaseous necrosis, fat necrosis, and fibrinoid necrosis. We start with coagulative necrosis in detail. So what is coagulative necrosis? It is a type of necrosis in which there is a denaturation of the protein and the enzymes. Here this thing is important, that is denaturation of the proteins and the enzymes. Hence the structural outline of the cell as well as lesion is maintained. Structural outline of the cell as well as the lesion is maintained. This type of the necrosis is frequently caused by lack of blood supply and is exemplified well in infarcts of solid organs. Example, heart, spleen, and kidneys. Almost all solid organ except brain. So this is the MCQ. All solid organ shows the coagulative type of the necrosis except brain. Brain shows the liquefactive type of the necrosis. We'll see later. So first example is myocardial infarction, commonly known as heart attack. Myocardial infarction, here the coronary occlusion causes ischemia, leading to the coagulative type of the necrosis of myofibrous. Myofibrous is muscle fibers of heart. Grossly, the area looks pale initially and whitish and fibrous in late stages, surrounding living cardiac muscles. So these are the gross changes in early forms of myocardial infarction. It looks pale initially and whitish and fibrous in late stages. Microscopically, initially the muscle fibers becomes wavy, then shows coagulative necrosis and hyalinization and contraction of the band necrosis. There will be neutrophilic infiltration is also seen, loss of nuclei and striations. Finally, in the end, the fibrous scar is seen, that is healed infarct. So this is the subendocardial myocardial infarction. So these are the various microscopic views showing the myocardial infarction and changes in the myofibrils. This one, the changes. Now next, splenic infarct. It is caused by occlusion of splenic artery or any of its branches. For example, infective endocarditis, septicemia, sickle cell anemia. This is one type of the hemolytic anemia. Grossly, here the small or the large, single or the multiple infarcts may be seen. Characteristically pale and wedge-shaped. Overlying capsule becomes opaque and the borders of the infarcts are hyperemic. So these gross changes are very important. We'll see in the photograph next. These are pale and wedge-shaped. Overlying capsule becomes opaque and borders of the infarcts are hyperemic. Microscopic view, there is a ischemic coagulative necrosis, means loss of nuclei, homogeneous eosinophilic cytoplasm, hyperemia, and an inflammatory response at interface between the living and the necrotic area. There is a gradual degradation of the dead tissue with phagocytosis. Most of the infarcts are ultimately replaced by the scar tissue. So this is the gross specimen showing the gross features, capsule opaque and the border infarct showing hyperemic changes. This is the gross specimen showing the splenic infarct. Now, next organ is kidney. And in kidney, we see the coagulative necrosis. Etiology is embolism, in which because of infective endocarditis vegetations and myocardial infarction complicated by the mural thrombus, that will lead to the embolism, and that embolism will lead to the coagulative necrosis. In some cases, that is the vasculitis, polyarthritis, nodus. Grossly, it may be single or the multiple, pale in color as that of the spleen. They here wedge-shaped scar or the wedge-shaped because of end arteries and may show the zone of hyperemia. And microscopic view, this is the wedge-shaped infarct. This is the wedge-shaped infarct on the kidney specimen. Cut section of the kidney showing right here. This is also showing the kidney infarct. So this is the hyperemic area with infarcted area. Now this is the microscopic view showing the necrosis, hyperemic area, and this is the viable part of the kidney. Now this part is the infarcted, and these are the small glomeruli associated with infarct. Now outline is maintained, but here is the destruction of the affected. This one is the glomerulus of the kidney. Now next type of the necrosis is liquefactive necrosis. It refers to a necrotic focus which liquefy and cavitates in the center. It may be encountered in the following setting. First, ischemia of the tissue, which are rich in lipid, fluids, and enzymes. Example, infarcts of the brain. Brain infarct or the uh, commonest example of the liquefactive necrosis is brain. Abscess, cavity containing pus, or the pus is liquid composed of viable and degenerating polymorphs, necrosed tissues, and proteolytic enzymes. It may be noted that amoebic abscess, the proteolytic toxins of the Entamoeba histolytica, is incriminated as a liquefying agents. Grossly, liquefactive necrosis looks like soft with liquefied center containing necrotic debris, ultimately discharge of the content from the cystic spaces. Now, this is the brain tissue showing the liquefactive necrosis. Now, this is the necrotic focus of the brain, and this is the normal or the viable brain parenchyma. This is the necrotic foci, liquefactive necrotic foci. This is also the brain focus, and this is the surrounding viable brain parenchyma. Now, third type of the necrosis is caseous necrosis. The term caseous is applied for both gross as well as microscopic features. Here, grossly, soft, granular, and friable, and cheesy appearance. Cheesy appearance is very important word for caseous necrosis. Pale white in color, microscopically, architecture completely effaced. That is in case of tuberculosis. TB is commonest example for caseous necrosis. Now, there are multiple granulomas composed of central area of caseations, eosinophilic granular or the amorphous material that is surrounded by the epithelioid cells, and epithelioid cells are nothing but the modified histiocytes, then lymphocytes, along with characteristic Langerhans type of the giant cells. These type of giant cells are horseshoe shaped type of the giant cells. The caseous area in the center shows fragmented bluish dots, that is nothing but the nuclear debris. We'll see the gross as well as microscopic photographs. So this is the lung specimen showing cheese-like appearance in the caseous necrosis. This is the lung parenchyma, and this is the cheese-like material in the lung. This is also showing the. Now this is the lymph node showing the caseous type of the necrosis. This is the cut section of the lymph node showing the cheese-like material, that is, and this is the microscopic view. This is the caseous necrosis. This is the giant cell, specifically Langerhans type of the giant cell is seen in case of, and here the lymphocytic ream is present around that granulomas. Oh, this is Langerhans type of the giant cell. This is the extensive caseous necrosis with inflammatory cell, that is lymphocytes. This is the classic Langerhans type of giant cell, horseshoe shape, which is seen in tuberculosis. Now, next part of the necrosis is fat necrosis. Grossly opaque and chalky in color. Microscopically, outline of the necrotic fat cells filled with amorphous basophilic material, that is calcium soaps. That is because of digestion of the peritoneal fat by the pancreatic enzyme in the pancreatic inflammations. So this is the chalky calcium sticks. This is the omentum showing fat necrosis. This is also the omentum. This is the microscopic view showing the fat or the adipocyte, mature adipocytes. These are the mature adipocytes. And here is the. Now, fifth type of the necrosis is fibrinoid necrosis. And the location is interstitial collagen and the blood vessels, small arteries and the arterioles are commonly involved. In allergic reactive diseases, active rheumatism, polyarthritis nodosa. In non-allergic reactive diseases, malignant hybridization is the classic example of fibrinoid necrosis. In allergic reactive diseases, rheumatism and the polyarthritis nodosa, but in non-allergic reactive diseases, malignant hybridization. Now this is the microscopic view showing the fibrinoid changes in the blood vessels. So this is the necrotic fibrinoid necrotic areas showing microscopic view. This is also the microscopic view. Vessels. Now next part is gangrene. Gangrene, it is a type of subtype of the necrosis. So what is the definition of the gangrene? Yeah, the massive necrosis of the tissue with superadded putrefactions, black in appearance, and the foul smelling. So it is nothing but the gangrene. Gangrenous inflammation is what? The primary changes in the inflammation. The causative bacteria is virulent enough to produce the massive necrosis either by direct action through their toxins or by causing thrombosis of the blood vessels. So what are the different types of gangrene? First one is dry gangrene and second is wet gangrene. First we'll start with dry gangrene. Here it only occurs when the skin surface following arterial obstruction. It is particularly liable to affect the limbs, especially in the toes. And characteristic feature is grossly mummification is seen. So this is the diabetic foot showing the dry gangrene. This is amputated foot and this is blackish area. So this is also the example of the dry gangrene. Now next type of the gangrene is wet gangrene. Here both arterial and the venous obstruction and wet in environment. So in case of dry gangrene, there is only arterial obstruction, but in case of wet gangrene, there is both arterial as well as venous obstruction. Characteristic features, it is wet, swollen, or the foul smelling, black or the greenish in color. Commonly seen in small intestine, appendix, lungs, uterus, and also in the limbs. So this is the intestine showing the wet gangrene with blackish discoloration. So this is also the intestine showing the blackish discoloration. So this part. This is also the intestine. So this is the amputated diabetic foot because of this ulcer. And generally in diabetes, there is a non-healing type of the ulcer. That's why we have to do the amputation in that cases. So this is diabetic foot showing the gangrene. Now third type of gangrene is gas gangrene. It is because of deep contaminated wounds in which there is a considerable muscle damaged by the gas formation bacteria. There are certain gas forming bacteria which causes the contamination and characteristically swollen obviously gas bubble formation. The infection rapidly spreads and there is associated severe toxemia. Only occasionally in civilian practice, but it is due to the serious complication in war wounds. Now the next part, which is very important for the short note perspective of the view, difference between dry gangrene and the wet gangrene. So the first is site. For dry gangrene, it's commonly in the limbs. Wet gangrene, commonly in the bowels. Mechanism, it is because of dry gangrene is because of arterial obstruction, and here wet gangrene mostly it is because of venous obstruction, but sometimes arterial obstruction is also there. In macroscopically, dry, shrunken, and blackish color of the dry gangrene. In case of wet, there is a moist, soft, and swollen, rotten, and the dark color in case of wet gangrene. Now next is putrefaction. It is limited due to the less blood supply in case of dry gangrene, but in case of wet gangrene, marked due to the congestion of organs with blood. Line of demarcation. This is very important point. Line of demarcation is present in dry gangrene, but here there is no clear-cut line of demarcation in wet gangrene. Bacteria responsible for the dry gangrene, generally bacteria fail to survive here, but wet gangrene there is a numerous bacteria. For example, uh, bacteria affecting the intestines. Prognosis better due to the septicemia, and here the poor due to the profound toxemia. Wet gangrene is having poor prognosis because of profound toxemia. Now, what are the sequence of the necrosis? First, acute inflammation, then repair and the regeneration. calcification, and after that gangrene. So next part of the cell death is apoptosis. We'll say in short, apoptosis is falling off or the dropping. It is a form of the coordinated internally programmed cell death. It is programmed cell death, coordinated and internally programmed cell death, physiological process during the development of the tissues, involution of the cell, then replacement of the cell epithelium, then thymus involutions. Sometimes it is pathological process. For example, cytotoxic T cells, atrophy of the organs, degenerative diseases. Apoptosis, it may be physiological or the pathological, but necrosis, keep in mind, it is only the pathological conditions. Now, this difference is very important. Apoptosis and necrosis, death of the single cell, but here many contagious cell death occurs. Here, chromatin condensation in case of apoptosis. In case of necrosis, there is a nuclear pycnosis, karyorrhexis, and the karyolysis. In case of apoptosis, there is a fragmentation of the nucleus and the cytoplasm. In case of necrosis, there is a frequent inflammatory response, but in case of apoptosis, no inflammatory response. In apoptosis, cytoplasmic bleb formation, but in necrosis, there is a plasma membrane disruptions. In case of apoptosis, lysosomal and organelles are intact, but here breakdown with release of the certain enzymes in case of necrosis. So these are the differences for exam perspective of the view, apoptosis and necrosis, and difference between dry gangrene and the wet gangrene. Now next point is phagocytis by adjacent cells and macrophages. Phagocytis by the macrophages in case of necrosis. Generally, in case of apoptosis, phagocytis by adjacent cells and the macrophages. In case of necrosis, phagocytis by the macrophages. In apoptosis, primary event occur in nucleus, that is activation of the associated genes. But in case of necrosis, cytoplasmic alteration preceded the nuclear changes or occur concurrently. So this is overall necrosis and the gangrene.